Thank you for joining us. My name is Vicki McHugh, and I'm a physical therapist and owner of Key Complete Therapies. We provide physical therapy, occupational therapy, and speech therapy across the lifespan here in the Metro Omaha area. And we are thrilled to have you joining us for our second presentation in this series, trying to help our consumers and clients navigate a little bit of the web of understanding the options between Medicare, Medicaid, and dual eligibility. So today we are thrilled to have our panel of presenters with us, and we're going to start with hearing from Steve Schmidt, who is an elder law attorney at Carlson Burnett, and he will be sharing some information about your option during open enrollment for how to know if you can select when to be looking at selecting different alternatives. We also then will go to Stephanie Swerzik, and she is the owner of Simplified Financial Solutions, and she is an independent insurance agent supporting people in finding affordable health insurance options. We are thrilled to have with us today Mr. Matthew LaFrance, and he is the Social Service Supervisor for Medicaid and Long-Term Care within the Nebraska Department of Health and Human Services. And he will be helping us understand a little bit about the additional considerations during open enrollment. We will finish with David Thompson, who is an associate attorney at Carlson and Burnett, and he will help wrap up our discussion, bringing his expertise with helping with estate planning and special needs trusts. So thank you again for joining us. We will be welcoming any questions as we go through the presentation. If you can submit those in the chat, and we will have our moderators help field those and have those addressed at conclusion of the presentation. So thank you again. And Steve, we're excited to hear what you have to share.
Hey. Like you said, my name is Steve Schmidt, and I'm an elder law attorney. So yeah, if you want to go to the next slide there, I don't really know a ton about this. They just asked me to be on here because I do a lot with Medicaid planning. So as you know, you can write down those dates here. I'm sure Stephanie or somebody will kind of expand on those a little bit further down the road. But in the area of Medicaid planning, I would say over 90% of my clients are above 65. So I deal mostly with when there's a concern about, okay, there's some debilitating disease or for some reason, somebody's going to have to be in assisted living for a long period of time, or even a fairly short period of time. How do we make sure they don't run out of assets? So that's most of my focus is on elder law and working with Medicaid in that arena, and also some VA benefits and stuff like that. So, yep, those are the dates that you have there in front of you. Like I said, I'm sure they'll kind of touch on those again down the road. And like Vicki said, the next speaker is one I'm sure we're all looking forward to hearing from. So Matthew, I'm going to turn it over to you.
Thanks, Steve. So yeah, like Vicki mentioned, I'm Matthew LaFrance with the Department of Health and Human Services. I'm a social service supervisor, do a lot with outreach in the Omaha area. We'll go to shelters and stuff like that at times and help some people fill out applications or, just answer some questions on what benefits they're eligible for. And I also help with refugee population in the Omaha area as well. Today, I was asked to come. Obviously, we are starting a new program. Well, it started October 1st, and that's Medicaid expansion. You guys may have also heard of it referred to as Heritage Health Adult. So that would be one in the same there. And I have a quick presentation. We'll kind of go over some of the new program and what the eligibility requirements look like. I think I should be able to share my screen here. Let me know if you guys are able to see that. Cool. I'm getting some thumbs up, so that's a good sign. I'll try to make this full screen. All right, so our Medicaid expansion is going to start covering adults aged 19 to 64 who annually earn up to 138% of the federal poverty level. So for an individual, that's around $17,000 per year. If you've dealt with any clients applying for Medicaid, obviously in the past, those in this age range did used to have to have like an eligible dependent or a child in the home or have special medical needs. A lot of the time we would refer people to apply for Social Security as Social Security disability would be one way they could also qualify for Medicaid. So this will extend that coverage to this age group where they do not have to have those requirements. So really it can be individuals, and we're just going to be looking at their income to see if they're eligible under this new program. And then like I said, the program itself is called Heritage Health Adult. Medicaid expansion is also what you may hear. It does build on top of our existing Heritage Health program for current Medicaid enrollees. So when we determine the eligibility here at the state, if someone becomes eligible, we hand it off to one of our 3 managed care plans. Currently, that's United Healthcare, Nebraska Total Care, and WellCare of Nebraska to actually manage the benefits and do the claims and all that kind of stuff. So it'll build on top of that where, if someone becomes eligible for the expansion, they would also be enrolled in one of those 3 plans as well. This just gives you a quick overview. As household size goes up, it does increase their income levels. So for a household size of 2, it's around $23,791. And that would be combined income of any spouses in the household. We also do look at gross income versus net income. And if there's any children in the household that they claim, we would only count their income if it meets the tax filing threshold, which is around $12,000 per year. So it may count children's dependents' income. It may not. It just kind of depends on how much they earn. But just gives you a quick overview that it does kind of raise as the household size goes up as well. We did launch this program October 1st. We had already been accepting applications starting August 1st, 2020. The last kind of update I had heard was that we had around 16,000 individuals that we've already been able to approve for this program since August 1st, since we started taking those applications, which that's exciting for us. We knew the need was there, and we're seeing it. The application process for this is not really going to change too much. So if you're already used to helping people apply, those normal ways they can apply would be good for this program as well. So that's online through our Access Nebraska website. Over the phone, they can also call in and fill out an application. They can visit any of our local offices in town. We are still open, kind of seeing clients different ways, of course, but we do still want to have that as an option. And then if there's paper applications, those can be filled out and sent to the normal ways as well. There's a email inbox there, PO box, they can send that in and then fax it in as well to a phone number there. So you won't see too much difference there. There isn't going to be any new applications even that you're looking for or an individual needs to fill out. It's going to be our existing applications, and those existing ways that we currently accept those applications can be utilized. I do want to highlight the online system though, Access Nebraska. I do think that's a good idea to set that up, whether that's the client or you guys helping to fill out those applications for a client. You can submit applications on there. You can also see the status of applications. You can see if there's any outstanding requests for any verifications. You can also upload documents through that system as well. So it kind of can cut back on some of the time to get these processed at times. Application process, I already kind of mentioned it, but there's not going to be too many changes, no new applications or anything. So using those existing applications to apply for this. We will inform the individual if they're eligible or not, so they will get a decision either way. And then if they are not eligible, we'll continue to send those applications back to the federal marketplace for consideration there. And then always individuals have rights to appeal these decisions. There is a 90-day time frame for appealing decisions, so keep that in mind. If they're denied or anything like that and thinking it's wrong and they really should be eligible, definitely let them know they can request that fair hearing. So I mentioned eligibility under this program. We're looking at income. Our current Medicaid eligibility requirements still apply as well, though. Obviously, Nebraska residency would be one of those. They have to be a Nebraska resident. There is no time frame really, so if they just moved to the state, they can apply for benefits really that same day. What we ask is, do you plan on making Nebraska your home? And if they say yes, that's good enough for us. And then obviously citizenship requirements as well. So either a US citizen or having a legal status as well. They need to kind of meet those requirements as well. And then we reassess eligibility for this on a yearly basis. There's boxes you can check on those applications for us to try to renew these electronically, so we don't have to send out any paper renewal forms or go through that process. We can look at our interfaces for income and unemployment and things like that get reported to us and try to do that renewal on the yearly basis. And then, as always, if there is any changes to the case, a new job, new household member, birth of a baby, anything like that, they do want to report those changes to us within 10 days. If they have, yeah.
Matthew, this is David Thompson. Can I just throw out a question that I've gotten over the chat?
Yeah.
So if someone is not eligible for the Medicaid expansion, probably just because their income is a little too high, and the application gets sent to the federal marketplace, what's the next step? How does the person who applied get notified from the federal marketplace? Is that a whole separate thing?
It would be separate. I believe they would get notified that they may qualify for like tax credits and things like that in order to help purchase plans on the federal marketplace. That would be the marketplace, though, that would reach out to them, whether they're eligible or not. I'm not too sure of how that all works, but I know it would be them reaching out to let them know they may be eligible for tax credits.
Okay, we actually have another question here I'll throw out. It says, I have a marketplace client who got accepted for Medicaid, and it gave them an October 1st date and said it was secondary insurance. What does that mean?
So it just means that an individual can be Medicaid eligible and also keep like a private insurance plan or an employer insurance plan. Medicaid will always be the payer of last resort. So if they have any other medical insurance, things would get billed to that first, and then Medicaid would pick up anything that's left over from there.
So what are the chances that somebody who makes $17,000 a year is going to have an employer provided insurance plan?
Yeah, I mean, it may be rare that they do have an employer sponsored plan, but yeah, they can always have other insurance and still keep that Medicaid coverage. It's just always going to be the payer of last resort for any bills.
So the premiums that they pay to that private insurer, that doesn't count as part of their income for determining whether or not they meet the federal poverty level guidelines?
So in most cases, no, we don't take those expenses into consideration. There is certain programs, and it's more so if you've heard non-Magi side or the aged, blind, and disabled side of Medicaid. On those, we do take expenses into consideration. So if they are paying for any other insurance plans, that would get into their budget and help kind of reduce their income level. And we have seen that has helped people become eligible when they previously weren't. Most of the clients under this new program, though, would not be under like an aged, blind, and disabled category. That would be separate from this. And in this case, it's considered MAGI budgeting, so medically adjusted gross income. That we don't take those healthcare expenses, at least, into consideration.
So can someone qualify for Medicaid in Nebraska and yet also be receiving dollars through the federal marketplace? And this will be my last question, by the way.
No, you have some good questions. I don't know if that would be a process, because if they're eligible for Medicaid, we're not going to inform the marketplace. I mean, we may inform them that they're eligible for Medicaid. So I don't think they would be then eligible for any like tax credits. That's my understanding, at least.
Okay, thanks.
Yeah. And I do have the chat box up here now on a separate screen too, so I can see if anyone else messages. Feel free to, guys. And 1 second here. Okay, so yeah, this kind of talks about that question you had. They can have insurance coverage through the marketplace. They can get private plans or employer-sponsored coverage. Like I had mentioned, that's going to always be the first payer, and Medicaid will always be that last payer of resort. And then you may have heard there's actually 2 benefit tiers related to this new Heritage Health program. A basic benefit tier is going to include all existing Medicaid services, with the exception of 3 things. That's dental, vision, and over-the-counter medications. And then prime benefits is the second tier. That's where it's going to include all those existing Medicaid services, plus the dental, vision, and over-the-counter medication coverage. So prime benefits, currently at least, are limited to those who are pregnant at the time they're applying, adults age 19 to 20, and then also medically frail individuals. And we'll get into that here in a few slides, what that all kind of means. This goes through kind of more in depth as far as what's covered. You see those basic benefits are a lot of the healthcare needs that many people have. It includes ambulatory care, emergency services, hospitalizations, maternity and newborn care, mental health and behavioral health, prescription drugs, rehabilitative or habilitative services, lab works, preventative wellness and chronic disease management appointments, and then other services such as long-term care, non-emergency medical transport, durable medical equipment. And then this last point, the basic benefits don't include dental and vision, but it would cover any emergency dental or vision, as those are billed under medical service. So when we talk about the prime benefits, it is going to include all those services, plus the dental, vision, and over-the-counter medications. And the dental and vision coverage there would be more for some of those checkup appointments and kind of yearly things. Like I talked about, if approved for this new program, they will join one of our 3 managed care organizations, those health plans under the Heritage Health program. Those health plans are the ones who coordinate and reimburse health services that the member receives. Once enrolled in a health plan, once approved for this program, they'll get sent notice of which plan they're put in. Originally, they will be provided a plan and a welcome packet from that plan. And then they have up to 90 days from the date they're approved to pick a different one if they so choose. So they can check out each of those 3 plans and see if there's any kind of added benefits to one in particular that would maybe work better for them. And then we always have our open enrollment every year as well, November 1st through December 15th. So currently in that. I see a question here. Do they have any expenses, premiums, or co-pays? I do not believe so, no. There should not be any co-pays with this insurance. And then I know I had a question emailed to me as well about when people can change their plans, if it's outside of the open enrollment period, outside of maybe that 90 days after they first get enrolled. Really, those are the main times when they can choose different plans. Throughout the year, if there's any major life changes, I believe they also have an opportunity to change plans, but it's pretty limited to the open enrollment period and to that 90 days. I see a question here. What are the differences in the plans? I can't talk too much about that, honestly. Each of those plans are going to have pretty similar services for most everything, and then they kind of have added benefits. Like I believe one of them provides like a membership to YMCA, that kind of stuff. So really, we tend to shy away from talking about the plans or maybe talking about one being better than the other. It's best, like I can send you guys some information, what we go off of when looking at the plans, but it's going to really be up to the client or you guys to kind of discuss that with them and see what's going to work best.
And we will help discuss this a little bit further in the presentation after your segment, Matthew.
Oh, perfect. Hopefully that can answer some of those questions. But I will send, if I need to send any further information, who should I send that to?
We can follow up with that on Bevan Phillips. Yeah.
Okay, sounds good. So here we'll talk about quick the medically frail determination. Many people eligible for expansion will have particular health needs and social determinants of health that may be barriers. They can be designated medically frail. Individuals who are determined medically frail by DHHS, by us, will receive those prime benefits. A quick thing to note here is an individual has to be eligible under the basic category first before we look into this medically frail. So if you're identifying any clients that you work with that you think may qualify under this program, main thing you want to worry about, at least at first, is getting in that application, making sure they're eligible for the basic program first, and then medically frail can be worked on from there. Here's some of the diagnoses or conditions that can lead to that determination. Those include a disabling mental disorder, chronic substance abuse disorder, physical, intellectual, or developmental disability with functional impairment that significantly impairs one from performing one or more activities of daily living, a disability determination based on Social Security criteria. I'll segue here really quick. If an individual is receiving Social Security and Medicare, they would not be eligible for this new program. So the main thing is the Medicare. If they're receiving or eligible for that, they're not eligible for the Heritage Health program. However, if they have that disability determination and they're receiving Social Security without Medicare, they could. Also, under this medically frail, if they have a serious or complex medical condition or otherwise chronically homeless, and that's defined through the United States Department of Housing and Urban Development. We kind of had this in here before we had this program in place, but we did start taking applications in August 1st. We know that we were able to approve some clients. Coverage itself does not start until October 1st, however. So some clients were already approved and were receiving Medicaid cards kind of before that October 1st date. Now we shouldn't be really running into that issue. And then the determination of medically frail can't happen until after the eligibility for HHA or Heritage Health occurs. On your end, if you're helping a client fill out an application and you think they may qualify under medically frail, it would be good to just make some notes on the application. There's usually a section on the bottom for tell me more information or tell me anything else. You can make notes there that they may have a condition or they're considered homeless. That process, once we determine their eligibility for basic, we can then start that process on our end with some of that information. One other way that clients can get that medically frail determination is if they're on Medicaid and have one of those 3 managed care plans, those plans through historical data can also make that referral to us as well if they note that a client may qualify for that as well. The third way is a client can also call in or kind of self-identify that they may qualify under this program. So if someone maybe forgets to put that on an application or once they're approved, wants to call in, we can start that process from there as well. And then retroactive eligibility goes back up to 3 months. Currently, we are still allowing that for this program. However, coverage for it kind of full stop won't start until October 1st. So currently we're in November. So we would only go back to October 1st for these populations if they do need any coverage in any previous months. If before that, if they have any bills that need covered, they would have to qualify under a current category that we have. And then we do have informational materials available. And these are can be ordered free of charge. There's some FAQ sheets, fact sheets, flyers, rack cards, things you can have in your locations for people to pick up or to hand out to them. And there's a link here. I will send that at the end as well, but those can be ordered, like I said, free of charge if you need any. So that kind of is my presentation over the new program. Was there any other questions?
So there's now 16,000 people who've been approved for benefits. And my understanding is that they think that up to about 80,000 people are going to qualify under Medicaid expansion.
Yeah, I think it was around 90,000 is what they were.
90,000 now?
Yeah.
Okay. So my question is, where does the money to fund that come from?
That's a good question, and a little maybe above my pay grade.
Okay.
But I think it's probably partially federally funded, probably partially state funded.
Okay. I think there was one more question on the chat.
Oh, yep, see that. One second here. The chat, there it is. I see one here. Could you repeat the information about Medicare and Social Security in relation to eligibility? So if someone is receiving Social Security and is receiving Medicare, they wouldn't qualify under this program. That could possibly be under one of those age, blind, and disabled categories. For those categories, though, I'm sure you guys are aware, we will look at income and also resources for those clients. So they may qualify under one of those programs, but they wouldn't qualify under this new Heritage Health adult program. And then if someone is eligible for Medicare through a disability, they are not eligible for the Medicaid expansion. Yeah, that would be correct. Was there any other questions? I don't mean to throw too much information at you guys.
Well, thank you, Matthew. I appreciate that information. I think there's just to, reiterate what you said, there's so much need. And so this is great to see that it's finally coming into play. I guess my one question might be is, do you anticipate that there might be any issues with access to providers because there's going to be so many more people utilizing these benefits?
I don't think that anything like that has been brought up, at least, that they see an issue with that. That could be an issue just currently because of everything we're going through. But no, I haven't heard that that would be an issue. All
right, awesome. Any other questions before we move to the next topic? I didn't see anything in the chat. All right. Thank you so much, Matthew. Well, my name is Stephanie Swerzik, and I'm the owner of Simplified Financial Solutions, as Vicki introduced me. And so I assist people with Medicare options, health insurance through the marketplace, and then some Medicaid spend down plans. I'm not going to cover too much of this. I'll kind of go over it at a high level again, because Matthew did cover a lot of this in his presentation, but just to reiterate, there are, Nebraska Heritage Health is the organization that's managing the state's Medicaid program. We've got the contact information there if anybody needs to jot it down. The 3 care organizations, or the managed care organizations, are now Healthy Blue, used to be Well Care of Nebraska, Nebraska Total Care, and United Healthcare Community Plan. He also mentioned you can make changes to the plan that is, if it's Sometimes if you don't elect a plan, it's automatically assigned. You have 90 days to make a change to that plan, or you can change during open enrollment. Again, November 1st through December 15th. Otherwise, I think Matthew talked too, if there's, a life-changing event, you might need to make a change, or for cause, if your quality of care that you're getting from your provider is not what you were hoping for, or you're just lacking access to services and providers, you could ask for an exception to make a change outside of the open enrollment period. I've kind of got a link here, and I think this is what Vicki had mentioned before, providing some additional details about what the different managed care organizations offer. And I'm not with a managed care organization, so I'm going to, again, speak high level, but this quick reference guide can help people at least have a starting point of knowing what the different organizations offer. I do think it's also important for people to be making informed choices when they're choosing these plans. Maybe speak with their providers even and find out if their experience is different with each of the different managed care organizations. Is there any limitations to the number of visits they can have? Is there, different services that are covered? Is there any costs that they would incur? So it's important for them to make those informed decisions. And the providers are they know firsthand how it may work with each of the different managed care organizations. That's all I was really going to cover with the Medicaid plans. Matthew did a great job kind of covering all those details. I want to jump into Medicare plans. It's annual enrollment right now. So annual enrollment gives people that are on Medicare the opportunity to make a change to their plans. Starts October 15th, goes through December 7th. So people can make a change. They can either go from original Medicare, which is Medicare hospitalization Part A, and then the medical coverage is under Part B. So they can switch from original Medicare to a Medicare Advantage plan. Those are also managed care plans through different insurance organizations that are available, and they're specific to each county that people live in. So they can change that. If they have a Medicare Advantage plan, this is the time of year where they can change from one insurance company to the next. Plans change every year. The deductibles change. The maximum out of pocket that people have to pay changes. The prescription drug formularies that's a part of those plans, those change every year. Preferred pharmacies, lots of different moving parts. And so this is the time of year where they can elect a new plan. They can change their prescription drug coverage. They have those same changes happening. Drug formularies change, happens a lot. One company may cover the prescription somebody's taking one year and it may not be covered the next. So it's good for people to be reviewing their coverage, making changes that will save them some money or just give them the coverage that they need. They can also elect to disenroll out of a Medicare Advantage plan this time of year, and any of the changes that they make now start January 1st. So it doesn't happen until January 1st timeframe. If someone makes a change and then for whatever reason things aren't working out on if they elect a Medicare Advantage plan, for example, and they want to make a change because the carrier, I'm sorry, I'm getting some feedback. I think that might be somebody's just not on mute. So if they elect a plan, enroll in a Medicare Advantage plan, and for whatever reason, maybe let's say their doctor's not in the network, they have a one-time opportunity to make a change to that plan from January 1st to March 31st. So they can do that, or if they get in a managed care plan with a Medicare Advantage plan, and it's just not what they expected, they can return to original Medicare Parts A and B, and a standalone drug plan. So they can make that switch back at that same time. Additional enrollment periods people have opportunities to make changes is maybe they're turning 65. That's when a lot of people are initially enrolled in Medicare. They are eligible the first of the month when they turn 65, unless their birthday happens to be on the 1st, and then it's the month before that. They're eligible the 24th month after their Social Security disability or railroad disability benefits begin. Their Medicare would start then on the 25th month after their disability. They also can make changes to their plans if they've already been receiving Social Security or railroad disability. When they turn 65, they have other options available to them. So that's another an initial enrollment period that they have. Or if somebody didn't initially sign up when they were first eligible for Medicare, they would need to sign up during what's called the general enrollment period, which runs January 1st through March 31st. And then they would have some additional opportunities to choose some supplemental plans then to begin July 1st. So lots of enrollment periods that are available for people possibly eligible for some Medicare benefits.
So just to clarify then, Stephanie, the little red, white, and blue card that everybody's familiar with, that gets mailed out automatically, what, like 3 months before you turn 65? Is that?
It does. That's a great question. So it will get mailed out automatically 3 months prior to their 65th birthday if they're already drawing Social Security benefits. The Social Security benefits is what's triggering that card. Same with the disability. If they're receiving Social Security disability, that card would get mailed out to them 3 months prior to their effective date. So collecting Social Security is really that trigger. If somebody's turning 65 but deferring Medicare benefits, then they actually have to take action to enroll in Medicare. Great question. I promise this will be the last enrollment period that I talk about because there's so many, and there's more than even the ones that I've listed, but these are the most common ones. There's some special enrollment periods. If somebody moves out of their service area, which is basically outside of their county most of the time, they have an opportunity to change plans because, especially with the Medicare Advantage plans, they're network driven. And so if you're moving, your provider is going to be outside of your network. If they are moving in or out of an institution, a skilled nursing facility, they have the opportunity to make a change to their plan. Perhaps a good time when that comes up is if somebody's moving to a skilled facility. Those skilled facilities often they all use the same pharmacy, or they have a dedicated pharmacy. So it's important for them to maybe look at what their cost is for their medications, because now they have a specific pharmacy that they need to make sure is in network. So that is an opportunity to make a change. They could have a change in their Medicaid status. And when I'm talking about Medicaid status here, it's different than what Matthew just discussed with the Heritage Health Adult. This would be the aged, blind, or disabled Medicaid status, or possibly somebody's on waiver, which I'm not going to dig into those details today. We'll talk more about that in the next session. But if they have a change in their Medicaid status, whether they are losing their Medicaid or just recently gained Medicaid, or possibly had just a change in level of Medicaid, that allows them to make changes to their Medicare plan as well. A spend down, if they've maybe done a spend down to qualify recently for Medicaid, a spend down would be if somebody purchases qualified health insurance policies, that would be reduced from their budget, adjust their income level to potentially qualify for some additional benefits through the Aged, Blind, and Disabled Medicaid health program. They can make changes if they qualify for extra help for medications. That's called low income subsidy. It's a very common thing for people to qualify for some extra help for just their medication costs. And that also gives them an opportunity to make a change to their Medicare plans, most often their prescription drug coverage. If they're leaving their group coverage, it gives them a special enrollment opportunity. And if they're eligible based on a chronic illness, or they have Medicare and Medicaid, it gives them an opportunity to make changes more frequently. So I want to kind of jump into that. So, and I'm trying to be cognizant of time. I think we're okay still, but I don't want to hold anybody over. So some of the plans that are available is if somebody has Medicare and Medicaid, again, if they're aged, blind, or disabled, Medicaid program, they do qualify for some special needs dual eligible plans. They must have Medicare and Medicaid. There's currently 3 carriers offering those plans in our area, Aetna, Humana, and United Healthcare. The benefits vary by company, so it's important to know. I kind of put some different probing questions in there, things that are important to know. It's important to know if their providers are in the network because they're network based. So if they see a provider outside of the network on these managed care plans, they are going to get a bill and not be happy about the surprise they receive because of using a provider outside the network. It's important that they know if their medications are covered. Is there any limitations? Is there a number of services that they can receive? And if they, hit that maximum, then what happens with that? Is there cost sharing involved? Is there any financial responsibility? So, and what company is best is a question that is asked often. And I'd say that is definitely, it's individualized. All these plans need to be customized and fit exactly or specific to the person and their needs because not everybody has the same medication, the same doctors, the same health history. And so it's important for people to reach out to resources, an independent insurance agent like myself. There's Aging Partners, there's Nebraska Area on Aging. All those agencies have support to help people. The SHIP office, they can help people find the resources to make sure they're making a well-informed decision. If they happen to choose the wrong plan or find out that their provider is not in network, again, they would have that they'd have an opportunity, especially if people are dual eligible, they have an opportunity to make a change to their plan once a quarter. The only time they're not allowed to make a change is the last quarter of the year during annual enrollment. It's locked out by Medicare. When eligibility is determined for these plans is at their initial meeting. So it would be most of the insurance companies offering these dual eligible plans are requiring people to be full dual eligibility. There are some exceptions to that. There's some, Aetna has a lower requirement. They'll offer some benefits. They may have some cost sharing if you're not at a specific Medicaid level. So it's important, again, just to do due diligence, make sure they know what the cost, if there's cost sharing involved. But most of the insurance companies, if you're fully Medicaid eligible and you also receive Medicare, then you're going to qualify for the benefits available on that plan. If people make a change, then their coverage is, again, going to start always the first of the following month. And as I mentioned previously, they can make one change per quarter, except for from October 1st through December 31st. The exception to that rule might be if sometimes changes are allowed at the last quarter of the year. If somebody had a change in their Medicaid status or recently moved here, then there may be an exception. So there's always exceptions, right? Some of the benefits of these dual eligible or special needs plans include no cost for their medications. Currently this year, there's just some low copays when people pick up their prescriptions. So some of the carriers are providing the benefit of no copays at all for their medication. There's some additional dental, vision, and hearing benefits on top of what the Nebraska Medicaid program provides. So they have some access to some additional benefits there. There's some additional transportation. And a lot of the transportation is actually managed by the Medicaid managed care organizations. People can get an emergency response button if they need one of those devices at home. There's meal delivery after a hospital stay, and then gym memberships too, to encourage wellness and healthy living. So those are just a few additional benefits that a lot of the providers offer. So any questions?
So I do have a question, Stephanie, but before I ask it, I just want to let everybody know that all four of us on the panel are greatly appreciative of Bev Ann Phillips' work. She's a therapist at Key Complete, but she also did a fantastic job at pulling together all these materials and making sure we stay on topic. So I just want to thank Bev Ann for that.
Yes.
But I also wanted to ask, I hope this isn't off topic, but could you say a little bit about supplemental policies and how they're different from Advantage policies?
Sure. Yeah, you bet. Okay, so Medicare supplement policy, they just work differently. So a Medicare supplement is available to members or to somebody who's Medicare eligible and is over the age 65 in the states of Nebraska and Iowa. If they're under 65, their only option to supplement Medicare is a Medicare Advantage plan. With a Medicare supplement, or people also refer to it as Medigap, then you pay a regular premium each month to an insurance company. Medicare pays their share, and the Medicare supplement would pick up the 20% difference on medical services. Some of those Medicare supplements have a deductible for the year, but once that deductible is met, then all the rest of it is covered. With a Medicare Advantage plan, it works differently. You may pay no premium for that coverage, or you may pay a small premium if it's a PPO network, but then you pay co-pays when you use services. So the cost is assigned when services are received, versus with the supplement, you pay a regular premium each month, and then you don't have costs later. Does that make sense?
Yeah.
Great.
So I have a couple other questions to ask, but does anybody else want to jump in here before we're getting close to wrapping up? Anyone want to send something through chat or audio? No? Okay, well, one of my questions, and I think this is something a lot of us have to deal with, one of my questions is about what happens when Medicaid or Medicare recipient goes into a facility. How does that change the situation? So for instance, and maybe Vicki can say something about this too. So if they're receiving therapy at home, say, PT or OT, and then they go into a facility, does that carry over, or is it different when the facility has its own therapists?
Sure. It does depend on the level of care that the individual is receiving. And so if they are moving from their personal residence in a freestanding community into a assisted living or independent living community, that person, that individual, would continue to have the right to select any willing provider, depending on what the policies and kind of the individual approach of the independent or assisted living facility might, what policy they may have about outside providers. Many assisted living or independent living facilities have partnerships with, as Stephanie mentioned, maybe they have kind of their partner that they like to work with from a pharmacy standpoint, or their beautician, or their therapy group. But that provider or that relationship doesn't necessarily dictate that individual has to use it. Many of those buildings offer that as a convenience measure, that it's a known and familiar relationship that they might share. The time when that would be remarkably different would be as if a client is being transferred into a long-term care placement, where that is a contracted entity, such as normally like a nursing home or a long-term care setting. Those agents or those buildings or facilities typically do have a payment structure and relationship that ends up delineating which provider they would work with. So if a client moves into a long-term care facility, most of the time they will be expected and required to work with the in-house therapist of that long-term care facility. And that usually has to do with how the payment structure is happening within the building.
Okay. Well, thank you. So one other question is, so if you're enrolled in one of the 3 Medicaid plans, your primary contact is probably your caseworker at the managed care organization. But then you're on Medicaid, so you probably have a DHHS caseworker assigned. And so, Matthew, maybe you can answer this. Like, when you said that that Medicaid or DHHS does periodical evaluations, and I don't know whether that's mostly focused on your resources or changes in your health status, but is all of that managed through like your DHHS caseworker separate from the managed care organization? I hope that makes sense.
Yeah, I think I got what you're coming at. On our side, we're just really kind of determining the client's eligibility. So those annual reviews on our side are updating income, updating resources, if there's new resources, getting those in the budget, or if there's any resources that they did have but don't have now, just kind of updating all that information. So that's kind of on our side what we do for those reviews, yeah.
Okay. Well, we still have a few minutes left. Does anybody else want to jump in with a question or two? We've covered everything, and now you're all experts, right? All right. Well, I think that's enough for today. We're going to want to let everybody.
I do have one
by 1 o'clock. Pardon?
I do have one clarification question. So we had talked about if someone gets on Medicaid and has a marketplace plan right now, it says that they can keep secondary insurance, but they need to get rid of the marketplace plan because otherwise they're going to be charged back for their subsidies, correct? Okay. So
I think, Matthew, that might be a question for you.
yeah, you can't be on Medicaid and the marketplace. Right. Okay. Thank you.
All right. Well, everybody enjoy the rest of your day. Thanks for joining us. And we are talking about a 3rd session of this panel, which we haven't picked an exact date yet, but we're aiming for January. So you'll all be hearing about that as well.